Welcome to the Connected Health Podcast. Today I have Kim Diehl with us, and she is a licensed insurance agent and here to talk about personalized health insurance options. She can help with health insurance, Medicare, supplemental insurance, dental and vision, as well as life insurance. Welcome to the podcast, Kim.
Hello, thanks for having me. I'm excited to be here.
What's the best way to describe what you do?
I'm a licensed health insurance agent. I feel like, first of all, people don't realize there's people like me out there, but really I'm a licensed health insurance agent. And really what I do is just work with individuals, families. Maybe they're coming off group insurance, or maybe they're starting their own business, or they're turning 26 and coming off their parents' insurance. And really what I do is just work with them to get a better understanding of their needs and what kind of care they require. And working with all the major health insurance carriers, I really just do like a fact finding and help them find the best health insurance based on what they're looking for and what will help them with their health insurance needs.
That's awesome. What does the process look like from a person initially chatting with you to helping them get the insurance that's best for them?
When I first talk to someone, really what I do is just do a fact finding. So getting, if it's just them getting insurance, if they have a loved one getting insurance, dependents getting insurance, and then really just getting a better understanding if any of them take prescriptions, if they have pre-existing conditions, also if they have doctors that they're wanting to stay with. So really during our initial call, I really just get a better understanding of all that stuff. And then that allows me to put together some options. Because I work with all the carriers, I do a little bit of research on my end before I send them quotes. But during the initial call too, I always just like to tell people, this is just an initial call. From here, we'll set up another call so you have the quotes in front of you. And when you have the quotes in front of you, I'll explain what you're looking at, how the plans work, and, just answering questions and concerns that they may have. And then from there, if we need to prepare more options for them, I'll send more options. And then from there, just kind of starting to limit down, like if they're liking it, what their concerns are, where we need to go from there.
And if I am understanding correctly, this is not like a service that requires a fee, but you're compensated in different ways, correct?
Correct. So how I'm compensated is I work with all the carriers. So they are the ones that compensate me. There's no fee to use me. I'm really just become your personal HR person. A lot of people are used to working with HR when they have group insurance. So really, I just become your personal HR person that is there to educate you on health insurance, but also figure out what is the best plan based on your needs. But yes, I get compensated through the carrier and there's no fee to use me.
That's awesome. I think that'll be helpful because there's really no barrier to entry, especially because insurance seems like such a complicated thing. And later on, we're going to break down what all the words and terminology means. But personally, I've had really bad experiences with licensed health insurance agents because you send in an inquiry and you put your information in and your phone is being blown up 30 times a day. And when you get on a call with them and it's not exactly what you're looking for, I have been hung up on. I'm sure not everybody does that, but I've had that experience. But how are you different from all of that?
I have heard that. I mean, I know when you put your information out there, you're going to get bombarded with a million calls, unfortunately. And unfortunately, there are insurance agents out there that really are just looking for a sale. And I don't like to work that way because I understand how confusing health insurance is. And really just the way that I approach my business is just, I like to say that I like to educate people just to kind of be there to support them through this process because it is confusing. So really just educating them on how health insurance works, what your options are, and just making sure that they have a better understanding of what's out there and how I can help throughout this process. Because unfortunately too, I do feel like a lot of the times people, when they need health insurance, they're typically just Googling health insurance. And sometimes people just want to enroll into something because it seems like health insurance. They say it's health insurance. And unfortunately, that's not always the case. But yeah, they think that it's the best and cheapest. So sometimes people just enroll into that. They don't realize that there's people like me that can help with all that and educate them and kind of just be there throughout the process. But also I always like to tell my clients too, like, I'm not just there to enroll them. Me and I have an assistant too, like, we are there throughout your whole time that you have health insurance. So I have clients that have been with me for 8 years, and really I'm just there for them to educate them as things change in their life, but also through open enrollment every year. And as they age into Medicare, or they have questions because they just had a baby, or they're wanting to add life insurance, I'm that person that's there for them to be there through every stage of life.
That is awesome. That's really special, and I've taken a peek at your website and read all the reviews, and they're all very positive, so you do
Oh,
amazing work.
yeah, and like I said too, it's cool. Like, I've had some clients that have been with me when I was a brand new agent, and have been with me for a long time, and it's cool because, like, when I do get to talk to them, it's you build a relationship with people, like, you get to hear, like, their stories, and as life changes, we just kinda grow together. It's kinda cool. I like it. It's fun.
Awesome. Very awesome. Can you break down the big complexities of insurance to us? There's a lot of acronyms like HMO and PPO and HSA and probably things that I don't even know. But let's start
Yeah.
there and you can kind of educate us. Do what you do best.
Yes. So, for as far as like, the main things people always ask are, like, what's HMO versus PPO? So HMO is like a health maintenance organization. Really, when it comes to HMO is gonna be sometimes mostly the cheapest option, but you're required to stay within the network, and you have to have a primary care physician that refers you to specialists. So anytime you wanna see a specialist, that primary care doctor has to refer you. PPO is a preferred provider organization, and that is typically more expensive than an HMO. Um, but it gives you more flexibility. So it allows you to go to doctors in network and out of network. Although a lot of the times the out of network is going to be higher cost, you still have the option and flexibility to do that. But PPO, too, like I said, is more expensive, but also you won't need referrals. So anytime you want to see a specialist, you could just go to that specialist. But I always like to tell my clients, always still make sure that they take this insurance, just because it's a PPO. Sometimes people just automatically assume that you can go anywhere. But that's not always the case. You want to still make sure that they're within the network so you get the best, most cost-effective pricing and co-pays, or even if it's out of network, like I said, you'll pay higher, but still making sure that they're in network. And there's also something called an EPO, and that EPO is called an exclusive provider organization. I always like to say that this is kind of a mixture of an HMO and a PPO, because that you have to stay within the network, but you still don't need a referral like an HMO. And a lot of those times, like, for example, here in Middle Tennessee, well, in Tennessee in general, we only have EPO under the marketplace for, like, the ACA, the Affordable Care Act. They only offer EPO plans. There's no other options unless you go with a private health insurance, then you can get a PPO. But typically the EPOs do, if you have the option of HMO, PPO, and EPO, a lot of the times the EPO is still more cost effective than the PPO, and still gives you that flexibility of not needing referral. And then also there is HSA, health savings account. A lot of the times people will ask about health savings because it gives you the opportunity to put money into a health savings account that's tax-free, and you can use that money towards your health, like co-pays, out-of-pocket cost. I typically would only really recommend those types of plans to someone that's used to it. A lot of the times that I do have people asking about HSA, they're coming off a group plan, and usually group insurance, they're contributing to that HSA. So you have, like, your health savings account, and they're putting a percentage into that health savings account that you can use. But when you get an HSA on your own, I just try to remind people you're not going to have that. It's your own money that you're putting in there that you have to use. So, a lot of those, sometimes people just get confused on how all that works. But HSA, is a great option if you're used to and know how to utilize it. So when it comes to the marketplace, which is like the ACA, Affordable Care Act, Obamacare, they all fall under the marketplace. So the marketplace is, like here in Tennessee, is an option to see if you could qualify for a subsidy. So a subsidy is a portion like the federal government will pay towards your monthly premium to help lower the cost. And that's based on a couple factors. One, your total number of household members, your estimated annual income. If you're W-2, we go off gross. If you're 1099, we go off adjusted gross. So those are those things I'm also asking during fact finding is like to see, I always like to weigh out both options for my clients. Like here in Tennessee, we have the option of private and marketplace. So I'm always asking those questions during our fact finding call to weigh out those options to see what is the best, most cost effective based on their needs. So asking the income, and depending on how many people are in the household, they could qualify for a subsidy. If you don't qualify for a subsidy, you're still allowed to get a health insurance plan under the marketplace, but you're just going to be paying full cost for it, which could sometimes be kind of expensive. And then also here in Tennessee, we have private health insurance. So the difference between the private health insurance and the marketplace is because the private health insurance plans do not fall under the ACA, you have to medically qualify for them. So clients that come to me that have pre-existing conditions, that have something had happened in the past, or they've had cancer within a certain amount of years, or they have diabetes, I wouldn't typically recommend a plan like that because even if they had cancer 10 years ago, but they have diabetes or something, they could still, they wouldn't cover pre-existing conditions the first year if they so happen to qualify for it. So those are just things that I'm, during that, like I said, the fact-finding call, I'm asking to see and weigh out those options, what is best. But yeah, a lot of the times that people that I do put on private health insurance, they're healthy, they make too much money, and they don't qualify for a subsidy under the marketplace. So, like I said, those are just things that I'm weighing out during our call.
And then I think this only applies to the marketplace, but there's bronze, silver, gold options.
So yeah, bronze, silver, and gold. So that kind of under the marketplace. And if you do qualify for a subsidy, one of the great things is you could also, if your income is low enough, which could be a good thing and a bad thing, you could qualify for cost sharing, which actually lowers a lot of the benefits on a silver plan. So yes, it goes bronze, silver, gold. And some states even have a platinum. Here in Tennessee, we only have bronze, silver, and gold. But those are just different tiers. And this kind of goes into a question that you were going to ask about how, if someone had more needs, basically, what would I recommend to them? Mm-hmm. So really, when I'm doing my fact-finding call, I'm kind of weighing out those options. But really, one thing I always look at, because the different tiers, the deductibles change. So bronze is going to be the cheapest monthly, but it's going to have the highest deductible, highest co-insurance, highest max out of pocket. And then from silver is the middle tier. So the deductibles change. They're a little bit less. Co-insurance starts to go down. And then the max out of pocket also starts to go down. But your premium is going up. So then from the silver, you go to the gold, the deductible continues to lower, co-insurance starts to lower still, and the max out of pocket, but you're paying a much higher premium. So unless you're qualifying for a lot of subsidy, those plans can be pretty expensive. It's really things that I kind of start to point out to my clients is how often are you going to the doctors? Copays and your deductible look scary on the bronze. But if you're not going to the doctor a lot, start to weigh out the option of what you would save monthly in cost on a premium. Maybe you're not going to the doctor a ton, but, you still have, even though the deductible is higher, it looks a little bit scary, but overall, you still would save some money. And I start to point out the deductible might not be that much different, or the max out of pocket, which is the max what you're going to spend in 1 year. Heaven forbid you used that plan and every aspect of that plan in 1 year. The max out of pocket might not be a significant difference compared to what you're paying in premium. Does that make sense? So those are things that I kind of start to point out to people. If they're going to the doctor a lot, maybe we do look at that silver or gold plan. But if it's something that's not cost effective for them and still, we could one of the things that I also talk to clients about is supplements. So supplements are things that you can add on to your plan. That's going to kind of help cover the gaps of what your major medical wouldn't cover, but pay money to you in the event of a hospitalization, emergency room visit, or even urgent care. If you had like an accident or injury, these are things that pay money to you that can kind of help cover those costs if you have a higher deductible and you're paying that when you have a bronze plan. So those are things that we kind of start to consider as we're having this fact-finding call, or I'm sending them quotes and they're looking at them and we're breaking it down of like how much they go to the doctor and how much they're utilizing the insurance. So those are just things, I kind of start to point out when we go over, and we kind of start to break down as we're going through the different plans together.
You seem very knowledgeable answering all my questions and all of everybody else's questions. And there's more.
Yeah. I mean, insurance is forever changing. But yeah, it's like I said, I like to just refer to it as educating people, because I said, like, a lot of the times people are just Googling things, and that's not necessarily the best thing to do. It just depends really on their needs and budget and how often they're utilizing insurance too.
It's very personalized, I'm noticing, which
Yeah.
is how I think it should be.
Right. And I always tell people too, for individual insurance and also Medicare, it's not like a one size fits all. I know sometimes people talk to their neighbor and they're like, well, Jennifer has this plan and it works great for her, but that's not necessarily what is best for you, So it's really based on your needs.
So I've heard the term open enrollment, but then there's also the possibility of getting insurance any time of year. Or how does that work? Like, what if you get a new job in June and it's the middle of the year?
So open enrollment is every year from November 1st to December 15th for under 65s. And then Medicare is October 15th to December 7th. But for individual health insurance, open enrollment basically allows anyone to enroll into a plan that doesn't have insurance. Or if you have insurance, it gives you the opportunity to change your plan for the new year. So those are times that me and my assistant start reaching out to clients, and we do policy reviews because sometimes needs change. So really, that's what we're doing, is making sure that you're set up for the new year based on your needs. And premiums change too. So, and deductibles and, all the things are changed for the new year. They can change. So really, that's what we do, is just make sure that you're still on the best plan for the new year. And then, yes, outside open enrollment, you have to have a SEP, which is a special enrollment period that qualifies, like a qualifying event, they say, that allows you to enroll into insurance outside open enrollment. So like SEPs, like qualifying events, are things like you lose your job, or you're leaving your job and you need insurance. They cut the insurance off, so that qualifies you to get a plan. Or you're coming off your parents' insurance because you're turned 26, or you have a baby, you get married, things like that. Those are things outside open enrollment that qualifies you to get insurance under the marketplace. So the private health insurance plans, you can actually enroll into any time of year, as you don't need a special enrollment period, but you have to still medically qualify for those plans. So if you can answer all the health questions without getting denied, then you can have those plans any time of year.
Very helpful. Okay, awesome. Yep. All right, this is a big question. How does insurance work? Some people have the misconception that it covers everything, or it's supposed to cover everything. How does it work?
So it really kind of goes based off, the different types of plans. So the marketplace under the ACA. So the ACA plans, I don't think I mentioned this before, but they don't look at pre-existing conditions. That's against the ACA. So if someone has had cancer or diabetes, you can get insurance under the marketplace. That doesn't matter. So how those plans work, really, I always tell my clients there's 3 things you want to look at: your deductible, your co-insurance, and your max out-of-pocket. Because really, every plan has those. Sometimes plans have 0 deductible, but typically on a plan, if you have deductible, that's always going to come first. you're paying towards your deductible unless you have a set copay for something. Like sometimes a lot of plans have primary visit copay for specialist. But then really outside of that, like any emergency room or hospital stay or diagnostic testing, you're paying towards your deductible. So you're paying towards your deductible. After you meet your deductible, you're paying coinsurance. So some will be like you're paying 50%, which means that insurance is paying 50%. So you're paying 50% coinsurance up until your annual max out of pocket, which is the max you're going to spend in 1 year on that plan. And that all depends, like goes back to the different tiers, what kind of deductible you have, what kind of coinsurance, what kind of max out of pocket. They change based on the tier you have. And then the private health insurance plan, same thing. You choose your deductible. Once you meet your deductible, you're paying coinsurance up, and then you're up until your annual max out of pocket. And then sometimes people think, I would say a lot of the times, people are asking you, oh, well, does your premium go towards your deductible? And that's not true. Like your premium is you're paying monthly to keep your insurance active. And then, if you're going to the doctor, you're going to show them your card, whatever type of insurance you have. If you have a copay, you're going to pay it there. And then really anything during that visit, I always tell people they're going to bill your insurance and your insurance is going to let you know if you owe anything. But then also back to the ACA plans, those plans under the ACA, everybody has an annual physical, like women wellness or men's annual physical. That is completely covered once a year under the ACA. Private health insurance, that's not necessarily true. They don't cover your annual physical. You're basically paying your copay, and then whatever you have done during that visit or physical, they're going to bill your insurance, and your insurance will let you know what you owe.
That's very helpful.
Yeah. So it just depends on what type of insurance you have.
Even with a broken system, how do you advise people to approach insurance?
Yeah, I mean, the only other thing I would really say is I look at insurance, it's designed to cover major things like accidents, injuries. Sometimes people get diagnosed with major critical or chronic illnesses or surgeries, things like that. It's hard to rely on our healthcare system. I feel like we should all be doing things outside our insurance to take care of ourselves, to keep ourselves healthy. I know insurance is important because we unfortunately have those unforeseen events in life that we can't plan for. So having insurance in place is important to be able to utilize it for things like that. But I feel like there are things that we should be doing every day to care for ourselves and not always rely on a prescription. But I think that that's important too, just because of how our world is today. Just taking care of yourself is important to live a longer life.
I agree.
Yeah.
That's exactly what I talk to people about is if you're not eating well, taking care of yourself, sleeping, exercising, you're going to have this over-reliance on things like insurance because you will have worse health. And the changes and choices you make today impact your future.
For sure.
And, I think about it, in my field is that going to the gym daily is a form of insurance because you're ensuring that your bones are strong, your muscles are strong,
Right.
so that you won't, have a freak accident and break all your bones.
Right.
Yeah.
And I feel like those things aren't talked about enough. People just, maybe just how they grew up, they just rely on, the healthcare system to take care of them or make them better. I think when you don't exercise or eat healthy, people don't realize how that affects you down the road.
Oh, yeah.
So then, unfortunately, as you get older and you have a fall and your bones aren't strong, that I feel like unfortunately causes more issues.
Yeah. And it's not too late. Like if you grew up not doing these things, you can always start today. Start
True.
even now.
Yeah.
Some of us have farther to travel than others, but I don't think anybody anywhere wants to take medications for the rest of their life. I mean, some people have to for certain things, but nobody wants that for themselves.
Right. Yeah. I agree.
Anyways, I could rant and vent for a very long time about these things.
Yeah, I know. I love all that stuff. So, as I was kind of telling you before.
Let me just throw myself as a personal example to make sure I'm understanding everything you've just taught us. But let's say I am a healthy person. I get into a freak car accident and need to be hospitalized, maybe I broke a bone. In that case, how would you advise me to approach insurance to make sure that I'm completely covered?
Like I said, it just goes back to fact finding, like working for yourself. If you make too much money and you are healthy now and you can qualify for the private health insurance, I would always recommend that option because typically for your age and how healthy you are, that's most likely is going to be a better, most cost effective option for you. Unless like having that once a year annual physical covered is really important to you and you're okay with paying a little bit more, but you're most likely going to have a little bit higher deductible, you can go the marketplace route. But I would say private health insurance plan, and I always recommend adding on, like we have some great accident supplements or different hospital supplements that will help if, heaven forbid, you did get in a car accident. And being self-employed too, like I said, those supplements pay money to you in the event of an accident and you're hospitalized. So your insurance obviously is still going to help you when you're in the hospital if you have a broken bone or need a surgery, but those supplements are going to pay money to you too in the event of that happening. And unfortunately, when you're self-employed, if you don't work, you're not making money.
Yeah.
So having those supplements in place to help cover that in the event of something, you missing work and being out because of that. So I would say a private health insurance plan and then just asking you like what kind of deductible is more comfortable for you because they have the different options and then adding on like some hospital accident supplements to help cover those costs.
Okay. So that was hypothetical, of course, but it's really, really personal based on whether or not I'm self-employed or employed by a company, supplements, non-supplements, private versus ACA. Like this is really good stuff.
Yeah. Yeah. It's confusing. People typically don't understand it, but that's why there's people like me out there to kind of help navigate them through the chaos of health insurance and just like I said, educating them.
Yeah. I also want to ask you your professional opinion on marketplace versus private. We've talked about that a lot, but also other options like health shares or direct primary care models. What do you think about those? And would they be good for certain people, or do you advise we stay away from something like that?
Yes. Really, when it comes to like health sharing, we used to be able to access those policies, but they were taken away from us, like the broker I work under, only because there were some lawsuits. I don't deal with that as much. But a lot of the times, people like those plans because they are inexpensive. But what tends to happen is not everything is covered. So, like the marketplace, like I said, it's major medical. You know what they're going to cover. It says on the summary of benefits. You're just giving them your insurance card anytime you go to the hospital or the doctor. And then, they're billing your insurance and your insurance is going to let you know what you owe. So you kind of know what is expected of you going into that plan, like what you're responsible for. Where the health sharing, you kind of don't because from my understanding, you're basically submitting a claim and hoping they pay it.
That is good to know and good to weigh when people are shopping for insurance. Are they
Yeah.
okay with that being a possibility?
Right. And sometimes people are because they don't want to pay a high premium for insurance. But sometimes those are the obstacles you run into having that type of plan.
I don't know if they would be classified concierge doctors, but there's a lot of places popping up, at least here in Nashville, where it's trying to be like a one-stop shop. You see a doctor,
Right.
you get your blood work done. Maybe there's, hormone replacement therapy, peptides, all of the things that regular insurance doesn't cover.
Mhm.
So if someone were interested in that, then from what you service and provide, would you recommend supplementary insurance on top of that? Or does it depend on the person? I guess I'm asking, how can somebody who would prefer that type of care also utilize your services and make sure they're covered in every area?
I don't have anything against those places. I think that they're great. I think that's just another way to take care of yourself outside of just any regular health insurance plan. But I think having a health insurance plan in place, even if it's a high deductible plan, like a catastrophic plan that allows you to utilize that plan for a major illness or accident or surgery. Because I know a lot of those places have memberships too. So I think still having a catastrophic plan and some supplements that would pay out for those illnesses or accidents or surgeries is a great approach to have both, to utilize both.
Good to know.
Yeah.
Is there anything else you want to share with the people?
I think if you need insurance, it kind of just goes back to just not going on the internet and Googling things and finding the cheapest plan that says that they're insurance. I have a lot of people that come to me because they do that and then they try to use the plan and nothing is covered. Or your doctor doesn't take it, even though they said it was like a PPO. I would just say, instead of doing that, reach out to someone like myself that can educate you on what is really out there and what's really going to work based on what you're looking for and what your needs are.
Awesome. Can you share where you're licensed, how people can find you online and work with you?
Yeah. So I'm actually licensed in 15 states. Gosh, let's see if I can name them all. Arizona, California, Texas, Florida, Tennessee, North and South Carolina, Missouri.
You're doing
I know
great.
I'm going to leave them out.
It's on your website.
Yeah, it's on my website. But and then my Instagram is Insurance with Kim Diehl. And my website is also kimdealinsurance.com, and you could put like a little inquiry on there and it goes straight to my email, and that's how we can start our initial conversation by setting up a call, and that's how I can help you.
That's awesome. Thank you so much for being on the Connected Health podcast. I'll include all those links down below if you want to reach out to Kim.
Thanks for having me.